Welcome back to HealthWise with our guest, Dr. Jennifer Tate Brasseaux, and we were talking about family eye care. Jen, we were talking about the different maladies, I guess, that cause eye injury or eye loss, eyesight loss. One of them we were talking about is glaucoma. What exactly is glaucoma?
Glaucoma is a disease that's typically slowly progressive over several years. Of course, there are several different types where you can have some that are acute and can cause you to lose your vision quickly. But the typical definition of glaucoma is a genetically inherited eye disease of high pressure that damages the optic nerve and causes you to lose your peripheral vision down to center.
Okay. So is any group more prone to getting glaucoma? Like, you know, I know you were saying it progressively or genetically, but is it more prevalent with older?
Your chances of getting glaucoma does increase with age, and it is also more prevalent with African American patients.
Okay. What about male versus female? You know,
no, there's not typically any prevalence between the two.
So it's just you know, but as you get older, your chances are. What about we hear a lot about cataracts?
Yes, cataracts. If we are all lucky enough to live long enough, we will all develop cataracts. It's an aging change of the lens, typically from years and years of UV exposure. Certain medications can cause you to develop cataracts early on, as well as diabetes. With fluctuation in the blood sugar, you can develop cataracts early. But you know, that's something to have monitored. As your cataracts develop and change, you will have some changes in your vision, and you will eventually need cataract surgery.
Okay. Well, and I mean, is that, you know, a lot of people say, oh my God, they're cutting on my eye or whatever. When they do that, I mean, is it just cutting away a layer? What, you know, exactly?
They make an incision into the eye and they remove the natural lens from the eye and replace it with a plastic implant. You can think of it like a contact lens inside the eye, which helps correct for the power of the eye. And a lot of patients said, I wish I had this done sooner, because it really does give you a second sight.
A new outlook, and they probably were having real foggy or blurred vision.
Correct.
For all these years. And
right, and it has become a much more simple procedure. It's outpatient these days. The procedure itself takes 10 or 15 minutes to do. Not as big of an ordeal as it used to be.
Wow, is it laser, or, you know, do they use a knife still?
No, it's an incision.
Okay, it's an incision. And I guess a lot of people want to ask, does it hurt? I mean, is it painful?
Well,
you know?
you will be sedated.
Right. No, but I mean afterwards, like
no.
if you. So
no, most
usually,
patients don't experience really any pain.
Okay. And the next question, you know, every time a lot of people go to the eye doctor, you see them, they come out with these real dark glasses, you know, and they're big and they're whatever. Why? What is that? Is that, you know, I know you dilate the eyes, but is that mainly?
Right. That's mainly the problem, is that those nice big pupils, and they're letting more light into the eye, and we're protecting, you know, from glare. But one of the main ones that you see are the cataract patients that just had their cataract surgery with those big wraparound sunglasses, and we're protecting from UV light, which is a good idea for everybody. Protecting yourself from UV light is going to prevent the progression of cataracts as quickly as it would, but it would also help prevent development of macular degeneration and those kinds of eye diseases.
Okay. What you were talking about, lazy eye, and, you know, you see people sometimes that they look like one eye is not functioning or whatever. Is that basically what lazy eye is? Is that?
That could be, lazy eye typically develops from that. You're talking about an eye turn, which is
right.
what we call strabismus, and with a patient that's developing vision, if they have one eye pointing one way and the other eye pointing a different way, the brain can't process two images at once, so it picks an eye, and it typically picks the one going straight ahead, and it tends to start ignoring the eye that's turned, and you don't develop normal vision in that eye, and that's what we call a lazy eye or amblyopia.
Okay, and I know just when I went to the eye doctor last time, man, on the wall there's all these different machines now, and all, you know, they have these little placards that tell you all these different things. I guess technology is really
really advanced in the eye field. Just within the last decade, lots of new shiny toys to play with.
Right, and I noticed one they had, it had this thing, and it was color. It had all these different. I can't think of what I'm trying to. It had this thing, and it said, you know, it just colored all the veins, all the different deals, and they said you could really just tell almost just a ton of illnesses just by looking at, you know.
It sounds like you're talking about a fluorescein angiogram, where they inject dye into your vessels and they take pictures of the retina as that dye flows through the vessels, and that lets us pick up whether or not there's macular degeneration or bleeding in the back of the eye, where they can point which vessel is actually leaking the blood in the back of the eye.
Okay. Well, like I said, that's, you know, I mean, that's way over my head. All these different, you know, because this technology, you know, and it's almost look like I would love to play with some of these machines because they all look like they're fun. But I mean, I know they have a purpose. Doc, after we have this brief message from our sponsors, we'll get back to more questions for HealthWise.